But let's continue along with our next guest who is here. And this is a month-long series of interviews that we'll be bringing you in the RNJ morning program. Did you know that depression affects more than 20 million adults in the U.S., but about 30% of them don't respond to traditional antidepressants? And my guest who's joining me here at the RNJ morning program, her clinic has offered some expanded access to a very innovative therapy, and she's here with me today to share some of that information on that from the Keta Medical Center. Let's welcome Dr. Haviva Malina to the RNJ morning program. Dr. Malina, good morning. It's Burt Barron, WRNJ Radio in New Jersey. How are you doing?
I'm good. Thank you for having me, Bert.
Great to speak with you. And dealing with depression and so many other different conditions and things, there's traditional things that sometimes work, sometimes not the best results. But this is an innovative therapy that you're offering and expanding the access to this. Have you seen heightened success rates with this particular therapy that you recently introduced?
Yes, we have. So, just to give you to frame it for you and give you some background on ketamine, ketamine is actually a very old medicine, and it's been around for a long time, but only more recently has been discovered to be very helpful for, depression, anxiety, and PTSD. And the difficult thing to swallow is that people that suffer from these, mental health conditions are often insufficiently treated with the traditional antidepressants. So people always assume that you go on a pill and you're going to feel better, when in fact that's really not the case. And there's a real need for something like ketamine, which can kind of fill the gap and help people sort of reach their treatment goals and just feel better. So we have been, at Keta Medical Center, our mission is really to make this accessible, available to everyone, to make, have insurance cover, some of the treatments, and to really, make this affordable and available in a medically supervised way.
Now, you do have a location here in New Jersey that, as we wrap up, I'll let you give out some information on that and how someone can reach out and get some more information about what you're offering. But was this fast-tracked at all, Dr. Malina, by the aftermath of the COVID-19 pandemic? Did this play any role in that?
Yes, very much so. So I am, myself and my co-founder, who happens to be my sister-in-law, Dr. Malina, and I are both emergency medicine physicians, have been in practice for 15 years. COVID-19 came along, and, everyone is very focused on sort of the physical manifestation of the virus. But after the virus kind of, calmed down and the aftermath, we noticed that there was really this uptick in, acute psychiatric cases and people who in real time we saw the anxiety, the depression, the isolation that was sort of, just percolating through after the COVID-19 pandemic. And, although this got sort of less press and was more sort of quote unquote silent, to us, it was no less important. And we really were sort of inspired to do something and to really help people manage their mental health challenges in a real way, and to sort of empower people to help them meet their treatment goals. And that's where ketamine came in. And, ketamine in the emergency room is used for other, for sedation in higher doses. It's used for other things. So we had experience using it, and we started to, be aware of, the mental health benefits that it could have. So we actually, New Jersey was our very first location. We opened it at this point almost 4 years ago, 3.5 years ago. And that's where sort of we started. We started to see people emerge on the other end of the treatment, really changed and improved, and that their mood was better, motivation was improved. And we were just totally taken by it. And we found so many ways in which, ketamine can sort of work more effectively without the same side effects as traditional antidepressants. So 3.5 years later, and, we have 5 locations in New York and New Jersey. And thankfully, we've been able to really reach a lot of people and help them.
It's so great to hear that you're having success with this on so many levels, Doctor. Dr. Haviva Malina is my guest this morning. Keta Medical Center, located here, as you heard her mention, in New York and New Jersey. We are going to give you some information about the New Jersey location in just a few moments.
Yes.
But it sounds like you're having some success, Dr. Malina, in sort of a wide range of different conditions. You had mentioned about anxiety, PTSD, and you've even seen success with this with individuals' OCD, bipolar, even alcohol addiction. You've made some inroads in that. That's really interesting.
Yeah, ketamine is this sort of interesting medication that wears a lot of different hats, and it's just emerging different ways in which it can be helpful, primarily for depression, but it does help with anxiety and PTSD. The concept of sort of, it works in a very unique way on the brain that the traditional antidepressants just don't work. So it literally creates like new pathways, new connections in the brain. And in doing so, people are kind of able to reframe their thinking, their behavior, their emotional responses in a way that can really be transformative, that can really kind of touch on their mood, touch on their motivation or their engagement. And all is done with, we are physician-led, physician-monitored. And so I think that's also an important aspect here, that we the doctors, sort of shepherd our patients through the process to make sure that they really, are able to meet their treatment goals.
That's really great. And it also sounds like, Doctor, you're keeping you're keeping pace with current trends as well, where the clinics, where the service is actually provided, less of a hospital feel. It's more of a warm, inviting sort of place where you feel like there's real support and real caring for your situation. Is that one of the things that you strive to provide at one of your locations?
Very, very much so. We really take a very patient-centered approach. We really want to get to know our patients. We want to understand their unique challenges and the things that they're struggle with. And we want to, and at the same time, though, we are, medically supervised and a reputable set of clinics. So I think that's important for patients and healthcare providers when they're considering their options, that we really have that sort of duality in our mission of really understanding the individual and doing everything from the very little details in our centers. Our centers are beautiful. Everyone has their own room, reclining chair. It's really like a nice vibe, a nice relaxing vibe in our centers. But at the same time, there's always a physician and nurse there. And we collaborate with patients, other psychiatrists or other therapists to kind of coordinate their care to make sure that, the intake process is all medically supervised. So very much so. That's an important feature of our mission.
That's great news, and I'm so happy that you were able to share it with me here on the program this morning, Dr. Malina. Someone listening and wants to reach out, maybe on behalf of a loved one or for themselves that's maybe interested in looking at some additional treatments, how do they contact you and maybe arrange an appointment or get to speak with you or someone on your staff?
Yes, absolutely. The first, connection would be to me because I conduct all the medical consults, sort of the intake process, myself. So they can either call our office, or our Dell office, which is our New Jersey location. The number is 201-483-3760. 201-483-3760, or certainly check us out on our website, www.ketamc.com, ketamc.com. We're open on the weekends and the evenings. Every aspect of our treatment center and our mission is geared towards patients. So we really try to accommodate and work with people.